injuries. Let's pray before we begin. We thank you, God, for this good Sabbath. And as we embark on our health nuggets, please give us understanding from above and also help us be able to do something about it and also be able to prevent it as it were. I pray this, believing in Jesus' name. My name is Dr. Tom Mogire, and today I'm going to take you through a short presentation on spinal cord injury. I'll try and define it and then go through a few of the causes which will lead to spinal cord injuries, and then I'll try to elucidate what may be the presenting symptoms or signs, and then we'll look at the various tests you may need to do when someone comes in a spinal cord injury, and then we'll look at the early care, long-term care, and finally we'll try to look at how to prevent these serious injuries. When you talk about spinal cord injury, or we look at the spinal cord, as it were, is basically an extension of the brain. And it begins from the lower part of the head and goes through the neck at the level of the thoracic and all the way to the tip of the spine. And it is made up of many nerve cells and a number of nerve fibers. So in a sense, it is composed of a mixture of both nerve cells, nerve fibers, and also there's the coverings of these nerve cells. And the main function of the spinal cord is to really transmit messages from the brain to all parts of the body, and also at the same time transmit senses from all parts of the body to the brain. And it basically is the main thing which helps us to move our hands, move our limbs, and be able to sense the various parts of the body in terms of touch, pain, and things like that. So it is really a very delicate structure, but then it is contained within the backbone, which is a very strong structure, which protects it from any injury. And within the hollow part of the back, that's where you contain your spinal cord. And as you know, the back is strong, yes, but also it has a lot of movements. So it's a delicate way you protect the spinal cord, but at the same time, you still have to allow the normal movement of the back. So those are things which are coordinated very well with the back. So if anything touches the spinal cord and injures it, then you end up with what we refer to as a spinal cord injury, and this will affect the various functions of the body, as it were. So if this spinal cord is very well protected, what can injure it? And what is the main causes we have in our setup? In our setup, the main causes of spinal cord injury is motor vehicle accidents and motorcycle accidents, which has been on a very rapid increase of recent because of various dangerous riding and things like that. And also falls. If people fall from heights, or they fall in a well, or they are working on construction sites, and they fall, it can also lead to a spinal cord injury. Other injuries you can get is during sports. When people engage in very active sports or contact sports, people can also end up sustaining spinal cord injury. Then the final one, which is the less common one, is when you have sharp objects like knives, bullets, or arrows which are directed to the spinal cord. This is rare because usually because of the bony protection that it may cause. But as it were, the commonest causes will be motor vehicle accident and when you have motorcycle accidents. Now, what are the main presentation you're going to expect patients who come with a spinal cord injury? When clients come with a spinal cord injury, the first thing they'll definitely tell you is that, I was involved in a form of an injury, either a fall or an accident. And then they'll also give you a complaint that they may be having a bit of pain on the part of the back which has been injured. But then the other main thing you may find is that they may not be having any feelings, or they may not have any sensation below the point of injury. So they lose sensation completely, whether you touch them or whatever, or even if you try to inflict pain on any part of the body. They'll also lose their movements. The ability to move the limbs will be lost. At the same time, if the injury is high enough, they'll also lose their bladder control. They cannot pass their urine and things like that, or the urine just flows out freely. They'll also lose their bowel function. They'll not be able to control their bowel functions. And injuries which are very high, they'll also have problems in their breathing, and they may also have labored breathing, as it were. And in very high injuries also, they lose their blood pressure control, or you may be having an unstable blood pressures. So the main tests you're going to do for patients who have a spinal cord injury is usually you do plain X-rays, which will show the bony injury and try to delineate what level of has been damaged. And then you go further and do more specialized tests like the CT scan, which will give you more details of the bony injury and the narrowing of the canal in the spinal area. And then the more definitive investigations you're going to do is an MRI scan. An MRI scan will delineate whereby the pressure on the spinal cord has occurred and how much pressure has been inflicted to the spinal cord. Then the other things you may do more detailed investigations is to just check whether there is an effect in terms of the blood system and other things like oxygenation level of the client when he presents. Now, there are things you may look at in terms of what level of injury does the person have. The level of injury can be delineated in terms of what part of the back has been hurt. And you can start from the high levels, like at the level of the neck, which is usually the highest level of the spinal cord. And then you can go lower to the level of the chest region, that is the thoracic area. And then you can go to the middle area, which is usually around the lumbar or at the level of the abdomen area, which is now the lower part. And then finally you have the lower part at the level of around the pelvis. Now, depending on the level of injury, it will determine what kind of damage or loss of function the person will have. Injuries at the level of the neck usually will give you what we refer to as a tetraplegia or quadriplegia. That implies you lose function of both the arms, and also you lose function of the legs. But then if the injury is lower down, maybe at around the thorax area or the chest area, then you only lose function of the lower part of the body, and then you have what we refer to as a paraplegia. So the higher the level you have, the more damage and more loss of function you're going to get. But then if the injury is much lower, then you have less in terms of functional loss. Now, you can also grade the injury in terms of severity. Severity implies that some people will have what we call a complete injury. Complete injury means that all the functions is lost. The person doesn't have any movement at all, no power at all. And then the other group you may describe is what we call incomplete, or they have only partial loss of function. So you may have loss of power which is not complete, but maybe they still have half of the power is maintained, or they may lose the power, but they still have a bit of sensation, or they can feel their parts of the body. So if someone has a complete injury, then that is more devastating in the sense that the recovery is less likely. But then if you have a partial injury, or what we may refer to as an incomplete injury, then usually we say that the prognosis is good. We do expect quite a substantial kind of recovery if the care is right. Now, when the patient has this spinal cord injury, what can you do? And especially at the site of injury. One of the things I'll try to say is that when you get someone who has been involved in a major injury, whether a fall from a very high height or in a major accident, you should assume all of them have a spinal cord injury until proved otherwise. So what does it mean? It means that when you're trying to move the patient, the injured person from the site of injury, you should always try and support their neck or support their spine, in the sense that you don't move the person in a haphazard manner, which may injure an already injured cord and make it worse. So you should always support their neck and support their back as much as possible, and try to put the neck in line with the head and don't rotate it in a haphazard manner. At the same time, if you're going to move a patient who's injured, then you try to move them with when you're about like 3 or 4 people, and support them in a very well controlled manner, and put them on a hardboard or on a hard stretcher, in a firm stretcher, so that you can move them to the hospital or move them to the nearest point of care. And then at the time they have reached the hospital, then the other things will fall in. So the moment they have reached the hospital, obviously we talked about the tests which need to be done. And then the moment you will confirm the patient has a spinal cord injury, then other things will kick in. So in terms of the hospital care, we may need to try and continue stabilizing the spine and make it well supported. And then at the same time, I mentioned that the blood pressure issues will set in, which you may need to try and control them and try to stabilize the blood pressures. At the same time, people with very high spinal cord injury, they may need oxygen support because they usually have difficulties in breathing and they may not have good oxygen supply to the tissues, and so you need to augment their oxygen supply. At the same time, we talked about they'll have bladder issues, they'll not be able to pass urine, so you may need to put in a tube into their bladder to be able to evacuate the urine and have a normal urine flow. And then you may need to give them laxatives because they usually have difficulties in opening their bowels, and then you have to give also laxatives to maintain the flow of the normal bowel movements. At the same time, the table they usually have, the patient cannot move their legs, they can't move their arms, and if they lie in that position for very long, they'll develop pressure sores, or what we call bed sores. So they need to have a comprehensive skin care, 2-hourly tanning, and also you need to apply some creams to prevent them from getting bed sores. And at least you may also get them special mattresses, which may be able to prevent them getting pressures in the various bony prominences, like we refer to as a ripple mattress. And then at the same time, as you keep caring for them, you may need to start them on physical therapy. And finally, you may want to do a definitive stabilization of their back to help them in the bone to heal in a good position. Now, people who have a spinal cord injury, remember that this is a major devastating injury, and they may need a long-term care so that to be able to get good results and prevent them going into long-term complications. So there are a number of things which you have to be taken care of, but I'll just give you a few examples of what really needs to be taken into consideration. And one of them is that they do need regular physical therapy, which should be started immediately and continued for a long time. And some of them who have partial loss of power, you may want to give them walking aids, maybe walking frames or crutches as they keep improving and regaining their power. And then as in the long term, you need to train their bladder, how they can be able to empty it regularly to prevent complications of infections in the kidneys. And then we've already talked about the skin care, which has to be continued for a long time, and having them special mattresses and so that to prevent it having sores. At the same time, there are risks of patients ending up with depression, so you may want to start them on counseling so that they can be able to get back to their normal self-esteem and be able to cope with the devastating injury which they have sustained. And also we need to rehabilitate them. Rehabilitation is a comprehensive word in the sense that some of them, because of their injury, they may not go back to their normal way of doing things. Because you are maybe stuck on a wheelchair, you may not be able to use stairs, depending whether you're staying in a high-rise building, or the work you're doing, maybe you're a construction worker, you may not be able to go back to your work of construction, and you may need to rehabilitate and even change your career, which can be devastating, but it needs to be thought about. At the same time, they need to go into good nutrition and also to help in their bowel movements and things like that. Now, what are some of the complications you do expect in terms of this spinal cord injury? They do develop infections in the lungs, pneumonia. They can also end up with chronic kidney diseases. And they do develop joint stiffnesses if the physical therapy is not instituted early and maintained. And they do develop a lot of muscle spasms or contractures, which is due to the muscle not being functioning pretty well or have abnormal reflexes. And I've already mentioned that depression is a big thing. Usually occurrence occurs to almost about 60% of the patients. And remember that this is a disease of the young. The average age of patients who have spinal cord injury is about 40 years, because it's the people who are active and who tend to really get affected. Now, there are things you can do to prevent spinal cord injury. And in a general term is that if you are traveling in a car, make sure you belt up so that you don't get major injuries if an accident occurs. And then if you're driving, drive safely. Motorcycle use is a big thing. People use motorcycles a lot. But then again, we also need to think about motorcycles being ridden safely, because the way they are driven, they are the major causes of accident currently. It needs to be thought about seriously. If you're a pedestrian, then make sure use the designated walkways, or if you're crossing the road, cross the road at the right designated points or use the overpasses. And people who are doing sports then need to think about safe conduct during their sports, avoid what we call a rough tackle and things like that, because you can easily end up having a spinal cord injury during your fun time. So one has to think about that. So in summary, what I'll say that spinal cord injury is a serious injury, and it disrupts the normal communication between the brain and the normal the other parts of the body. And you may either be, it's a partial or an incomplete, it may be a complete or a partial injury. And it may usually, what you should know, that is caused by a heavy force. And remember, the victims need all our care, counseling, and also trying to get them to get back into their society. And then we should all do something to try and prevent them. Thank you very much. Happy Sabbath.